Welcome to America's Heroes Group.
Welcome back to America's Heroes Group Roundtable, Healthcare Community Outreach. Today is Saturday, April 2nd, 2022. April is Sexual Assault and Autism Awareness Month. Make sure that you can spend some time thinking about these issues and helping people who are battling these issues. Also, our host is Kelley, and he's the Honorable Cliff Kelley, and I am his co-host, Colonel Dr. Damon Arnold. The executive producer is Glenda Smith, and our digital media producer is Ivan Ortega of Scouts Honor Productions, the iconic productions group. Today we have a panelist, Larry Nazimek. And Larry Nazimek is a U.S. Air Force veteran and vice chair of Coalition of Veteran Organizations. And when I had to take one moment to look at someone that's like this man. This man is just absolutely incredible. He received his BS and MS in aeronautical and astronautical engineering from the University of Illinois. That's one of my alma maters. He went on to work for the McDonnell Douglas Astronautics Company with a job title of Associate Engineer Scientist, where he worked on the Spartan, ABM, and the Skylab project. You may have heard of that before. He served in the United States Air Force, where he was dual rated as a pilot and navigator. He was a weapons systems officer in the F-4 Phantom and a pilot in the T-38 Talon, a B-52 Stratofortress. In addition to CVO, he is a member of the Veteran Strike Force, Chicago Vets, SAG-AFTRA, which is a Screen Actors Guild, American Federation of Telephone and Radio Artists, Aircraft Owners and Pilots Association, Experimental Aircraft Association. He serves as a beat-off facilitator and a member of the 25th Police District. He's also on the advisory council, where he also does occasional film and TV work and writes for aviation magazines. I don't know where you get any sleep in with all of this going on in your life, Larry.
I don't. I'm addicted to caffeine pills.
That sounds high speed. Love it. Yeah.
Sleepless underachievers.
I had to read that because we have to honor those people who have done so much for the country. And just by what you've done, you have been an icon. People need to follow this, and the young people out there need to know what is possible with your human body and human mind. And it looks like you have excelled and really just incredible history that you have. And today I know our discussion is on veterans' lack of dental care, but you actually just personified so many things. I just had to read that in the background.
Oh, thanks for the kind words, but the real heroes are the ones who didn't make it back.
Yeah, our Gold Star families, I tell you, they always hold a special part in our heart, a place in our heart for their losses and their heroes that defended the nation. Absolutely right. But yeah, so what is this thing about veterans' lack of dental care? Why is that so important?
So important because the VA isn't giving it to us. You can't say that our health care is complete. As a matter of fact, when I get all these different surveys from the VA, telephone surveys, after I make a phone call, whatever, do I trust the VA? Is the VA giving me everything I need? I have to say no, because they're not. Why is dental care singled out? I don't know. If you're going to single something out on a basis of cost, there's maybe podiatry or cardiology or oncology, because not everybody needs each one of those specialties, but everybody needs dental care. And modern medical science has shown that poor dental care is related to many other diseases, such as diabetes, heart disease, cancer, COVID-19, Alzheimer's, and several others. And a lot of the congressmen talk about, look what it's going to cost. Yeah, but you're going to save money on the backside, because you're not going to have to spend so much on treating these other diseases, not to mention the alleviation of pain. Mm-hmm. And also, if dental care was important when we were in uniform, the government needed us to be in good shape to do our important jobs. why isn't it important now? It's like, well, man, we got what we wanted out of you, so the hell with you now.
Yeah, that's really an important point, Larry, because the gateway to our body and our health is the mouth, right?
Absolutely.
and our dental, care looks at how we we start thinking about how our nutrition plays into our overall survival, whether we're getting adequate nutrition, and the proper dental care actually gives you alleviation of pain many times. Many people go around with dental caries or cavities, as we call them, that need to have adequate care. And you make a really excellent point. I've never heard it put that way before, but you spend more money on cardiology, right? Just
Sure.
doing a diagnostic test, or sometimes over-testing with things like radiology in the orthopedic realm. But the dental is so critically important to our health.
Or for that matter, even gender reassignment.
Oh, yes, yeah.
Yeah.
Yeah, there's so many things that we're spending money on that, we're overlooking something that is primary and basic to everybody. We need to have that, the ability to make sure that we can survive. So what have they been doing so far? What do they cover, and what don't they cover?
Well, there's only about 8 to 15%, depending on which whose set of statistics you want to listen to. Of only 8 to 15% of veterans enrolled in the VA for health care are eligible for the dental care. You can get it if you're 100% disabled, or a former prisoner of war, or if you're being treated for something that involves the mouth, like let's say if you've been shot in the jaw or shot in the face. And so those people are going to get the dental care, but others they're not.
Wow. So everyone else is just sort of on their own.
That's exactly it. And it's not like everybody has the money for it. And we've seen some really horrible cases. And sometimes people who are in need look to us thinking that we can, wave a magic wand and get them dental care. Well, we can't. But, I mean, one of the emails I remember from a guy in New Hampshire, it was pretty obvious, well, maybe not exactly obvious. I shouldn't use the word obvious, but there was, let's just say, a very good chance that he was going to be taking his own life. And after I referred him to somebody who could refer him to somebody else, but I also contacted the suicide prevention people at the Jesse Brown Hospital so they could call their counterparts in New Hampshire.
Yeah, and is this a federal level thing? So
Oh yes, absolutely.
Yeah. So it doesn't make a difference what state you're living in. If you're a veteran, the dental care is still on the same kind of platform.
Yeah. Now some states are thinking about having some special programs, but I'm not aware of any that have it at the present time. Just stuff that's being considered. And now we're not talking about the cosmetic stuff. All the stuff about white teeth whitening and that stuff. No, we're not talking about the cosmetic stuff. We're talking about the necessary stuff. And so there are two bills in common. There's one in the House, 914. There have been several bills, and they each die in committee. Don't get anywhere. Now we're on H.R. 914. Got 51 co-sponsors. Because of our efforts, Illinois has 11 co-sponsors, and the nearest states are California and New York with 5 each. So we've been doing some work over there. Of course, Danny Davis is one of the co-sponsors, one of the first ones. He's been with us all along. Yes. And when it comes to the Senate, well, that one was just introduced by Bernie Sanders this past October. Hasn't been around that long. It only got like 7 co-sponsors. And I tell you, we're highly disappointed in our senators from the state of Illinois. I tell you, when it came to Senator Duckworth, the letter that we got back was just about all her different things that she's doing for veterans. And, of course, we realize that it's the staffers who write the letters. The senator, I can't even keep up with my email. But anyway, the letter we got back was just about all things she's doing for veterans, but didn't even mention the word dental. And when we complained about that, we got a response back that detailed all the details of the bill. But no, not going to be a co-sponsor. When it comes out of committee, I'll support it. And then when it comes to Senator Durbin, this is not the first time we've gotten a similar response to this. But so, don't you know, like as if we're ignorant about something? Don't you know you have this veterans dental insurance plans are VADA, or VADA, VADIP, Veterans Administration Dental Insurance Plan. Yeah, right. Not that, first of all, not that many veterans have taken advantage of it. Maybe I shouldn't even use the word advantage. Let's just say a relatively few percentage of veterans participate, and out of those, it ain't cheap. He acts like it's a cheap program. It's not a cheap program. Mm-hmm. I was in it before. I was paying I think $58 a month. I should say that there are different levels depending on what you want. If you take the lower price level, you get nothing, virtually nothing. Mm-hmm. It's one from Delta Dental, as I understand, doesn't even give you dentures unless you're with them for a full year. Right. I took the works with MetLife, $58 a month, and then I think I paid my dentist about $2,867 for the year. Not everybody can afford that.
Yeah, right. Yeah, because most dental plans, they really don't cover much of the work. Yeah. I've experienced that quite a few times. Yeah. You're kind of shocked. It's like, well, why do I have insurance if I'm going to be paying out of pocket for most of it? And that's really absolutely terrible. And you're right. Not everyone can afford these plans, especially if you are a veteran. And we have many homeless veterans, right?
Oh, yeah.
Who their dental care is critical for them because they're, living in a very austere environment, and many times are not, getting meals that can support their nutrition adequately. So this is really critical for many people who are out there in the veteran world. And there's a TRICARE, but they have a supplement, right? How's that work?
I can't explain TRICARE.
Oh, yeah.
No,
okay.
We're just talking about the VA program.
Oh, that's the VA program? Yeah.
I said, what the VA provides the stuff with TRICARE, that's an entirely different program.
Yeah, because TRICARE doesn't have, they don't have a dental component to it. You have to buy that as a supplement. And then you have, if you go through, the Medicare side of things, you still have to buy, supplemental dental. So it's something that, for our veterans, the ones who sacrifice their lives, put their lives on the line. And many times we have dental problems. I mean, when I was deployed to combat, to Iraq, they pulled 2 teeth. I went and said, can you put a crown on the teeth? And they said, crown? They just pulled them.
Yep.
And they said, keep going.
Exactly.
So when I got back, I actually had to have a couple of a bridge, a couple of bridges put in that I had to pay out of pocket for, and they said they didn't cover dental.
Yep. And there's been some recent studies. People say, well, some civilian plans health plans don't have dental. They say, well, why should veterans get it? Well, there's just been a recent study, and I just got the letter a few days ago, about a week ago. It's going to the Senate Veterans Affairs Committee. And it's put out by this American Institute for Dental Public Health, and they had some good statistics. Because obviously, I'm not a dentist, but even we do have a dentist on our board who's been on your program before, Mark Wyman. But anyway, we don't have access to all. Or you have an organization doing these studies, so I got statistics, and they say 42% of veterans reported having had gum disease, gum problems, or bone loss around their teeth. And that's higher than non-veterans, which is 27%. Mm-hmm. And they say similarly, more than half, that's 56% of veterans report having active and treated decay, and that's higher than their general population, which is non-veteran population, which is 37%. Isn't that something?
Yeah, that's a huge difference.
Oh, yeah.
Yeah. I mean, if we were looking at cancer, breast cancer, prostate, anything other condition, cardiovascular, we'd be astounded that there was such a big difference between these two groups.
Oh yeah, mm-hmm. And they say that 40% of veterans describe their oral health as fair or poor, translating into approximately 8 million veterans with self-reported suboptimal oral health.
Wow. Yeah. So what do you think the answer is? How can veterans get involved in this issue? Because in order for veterans issues to be rectified, we have to play some kind of role in this and make sure that we're deeply involved in this process.
It's a matter of holding the politicians, holding congressmen, senators accountable. really. Now, it's difficult to reach, if you're not a part of an organization, to reach the congressmen or senators who are not from your state. If you're a national organization, you have a better chance of doing that. But, well, of course, in the state of Illinois, I said we already have the 11 co-sponsors, but there's more that we don't have. The ones that we don't have are Schneider, Foster, and the 5 Republicans. So if you're in their district, get on them. And it's a matter of contacting their D.C. offices, not their local offices, because D.C. offices deal with legislation. Local offices deal with constituent services. And, of course, with our 2 senators. Now, as far as a national organization, if you belong to American Legion or Veterans of Foreign Wars, ask them what they're doing. And I was astounded when I looked at the American Legion's website. They have their legislative section, and they got legislative priorities for the 117th Congress. Dental care was not listed there.
Wow. So it definitely should be, huh?
Oh, yeah. I know their names is listed when they have these, like when the bills in H.R. 914 and S3017 were introduced. I know the name of the American Legion was listed as organization supporting it, but I was really astounded when I didn't see it listed as one of their legislative priorities.
You know, and one of the things that we have, and you were mentioning before about 8 to 15% of veterans, may be involved in somewhat in this dental plan. And I'm wondering, and you're saying you have to have 100% disability or, POW or, oral trauma that, incites this dental problem. And I'm wondering, when people are overseas, I saw people many times, biting down on a bullet, pulling, gear out and doing things with their teeth we probably should not be doing, and eating MREs that will kind of crack, that kind of crack your tooth.
Yeah.
But they're not being reported, so they're considered not to be service connected. And that's another thing that happens many times. So those people who are actually in service and who do have a dental insult, where they actually fracture a tooth, they should be reporting those, right?
Oh, absolutely. Yeah,
and make sure it gets into the record, because many times those things are not entered correctly, into records. So with the dental piece of it, do you think that there is anything that from the dental community, what they could do, or because we do have military dentists as well, that they can be somehow involved in this, because they see this all the time, right? And we have retired dentists from the military, oral surgeons, and they should be involved in this as well, because they've witnessed it.
There are certain programs for, we have the Veteran Smile program here, and that's it's an excellent program, but it's you have to really be of low financial means to qualify, because obviously they can't take care of everybody. They wish they could, but there's only so much to go around, and there are different organizations like that, and there are various groups, like a lot of dentists will give free dental care on Veterans Day. Well, they'll give you a couple cavities. They don't do any crowns or anything serious. They'll do a cleaning. And Aspen Dental used to have their day of service in June. They hadn't had it for a while due to the panic, but they had it for Veterans Day. And now there's again various plans or various proposals, and I know there's one called Vet Smile. That was in December of 2019. The VA's Innovation Office put forth a proposal for a pilot program that went in the Federal Register. That's December 2019, and it had to go through Congress. So it went through Congress as HJR House Joint Resolution 90, I believe it was, or 80, and it passed unanimously. And still waiting for something to happen. It happened. They got it going, I think, in New York, New Jersey, and maybe it'll happen in Chicago soon. I mean, I've been in touch with those people asking, what's going on here. But we had this town hall meeting after Jesse Brown Hospital, and one of our members asked the chief of staff there, what's going on with the program, what's the status? And she said, you never heard of it. And so,
Really?
afterwards I emailed her a copy of the Federal Register thing. She says, "Oh yeah, we got that. We have a list of low cost or free dental clinics." No, that's not the program.
No. Wow.
And so anyway, then recently that I went through the patient advocate because after another town hall meeting that we had, and he went to the head dentist at Jesse Brown, and he said, "No, we're not participating." But I am in contact now. I just got an email about yesterday, I think it was, yesterday from this innovation people because I've been writing to them enough. And so we're working on it, and we'll be in touch with you. I'd like to discuss it second week of April. We'll see what happens there. But again, we just don't know how much that's going to provide. One of the things that was accomplished, though, with this program is that the Congress had to play a waiver, believe it or not, a waiver to grant dental care.
A waiver to grant dental care?
A waiver, yeah.
Okay.
Yeah, a waiver to grant the dental care. So because of that waiver, now they can have the the pilot program.
Oh boy. Okay. And something that you said, Larry, earlier that really resonated with me, and it was the idea that for example, the Veteran Smile program, you only have a certain amount of resources that can be distributed to people, and it's really pretty much low income. So maybe that's helping some of the homeless veterans. But it seems like we should be able to, we price everything in the military, right?
Yeah.
So why can't you have a dental program with government controlled? They hire the dentist and pay the dentist to do as much work as they can on veterans. And and just have them as part of and that you can actually control your prices and make sure that the government is not being gouged by outside providers.
Well, not only that, you have the Mission Act that has provisions for students in the medical dental schools. They're going to take care of student debt. And when you think of student debt for dentists, I mean, you got to practically sell your soul to pay it.
That's true. Yeah. So that might be a way of them, going in with professional dentists. I know that they do have that, like in the University of Illinois. That they actually have a dental clinic where the instructors work with students and.
I know it very well.
Yes. Yeah. Why can't we have that on the federal side? It does for veterans. It doesn't make sense.
Yeah. And even like I say, how it impacts your diabetes. They say that 22% of veterans are living with diabetes compared to 10% of non-veterans.
Yeah, that's another issue because that definitely impacts your dental care and quality of teeth. Teeth, yeah. We're running close on time. Yeah. What I want to do is, if you have something that people should be looking at, is there a website that people can go to participate in this, or should they just be looking and doing things like Google search on the House Bill 914?
Yeah, it's the bills because that's really what counts.
Yeah.
And I go to Congress.gov. I use that all the time.
Okay.
And you can just put the number of the bill in the search box and find it, and you can see who co-sponsored and who didn't. But you got to work on the congressmen, and like I say, though, we have the 7 in Illinois who have not co-sponsored, and both our senators have not co-sponsored.
Yeah.
Get on them. There's election coming up.
Yeah, I was just thinking about that. There is election time, but we have many veterans, and we want to support our congressional members, and thank goodness we have people like Danny Davis, as you were mentioning, who wants to help and cares about our veterans really deeply.
Yeah.
But we should, and I don't want to see anyone sort of standing up and waving a flag, saying that we support our veterans, that's in elected office without having ever served, and then to go in and not support bills like this for our veterans. That's really deceitful.
Yeah, and telling us that it costs too much, I already said about why it's not going to cost all that much in the long run, but it's another way of saying, if you tell me it costs too much, you tell me we're not worth it.
All right. So it looks like you're, we're at that time period. And I'm going to tell you, Larry Nazimek, I'm going to put your picture up on my wall with
please don't.
your history because you're extraordinary.
No, thank you.
Thank you for your service again to this nation. And we are going to, we're going to have to follow up with you at some point about this with the House Bill 914 and see what
Certainly will.
Okay, great. We're going to go on to a commercial break, but we were just having a great time with Larry. Stay with us. Stay with us.